Dr. Mike, he's one of our favorite YouTubers, and he just did a segment on health risks and benefits of viral beauty trends. We want to look at this and kind of give you the surgeon's perspective of Dr. Mike's interpretation being an internist. He's actually a real doctor too. He's not just a social media doctor like you see. So he's legit. Let's check it out.
And then comes the very important part of wearing SPF. And that SPF, that sun protection, is so important if you're outside for many hours throughout the day. But that being said, being outdoors for 15 minutes in the morning while you have your coffee and having sun exposure is considered a healthy habit.
Okay, this is a great topic. I think Dr. Mike's spot on this. In plastic surgery, the worst thing in terms of anti-aging is being in the sun. If I could tell people one thing, it would be wear sunblock, because that will make you look so much younger as you get older. The people that wear no sunscreen or in the sun a lot, they have a lot of actinic changes, leathery skin. So Dr. Mike is spot on.
I struggle with this. Perspiration. I used to have a blow dryer near me at all times to blow dry my armpits in the middle of filming. Deodorant, that's gonna add scent. That's gonna try and remove some of the bacteria in the area, therefore reducing the smell. Antiperspirant, especially if put on the night before, can plug your sweat glands in your armpits, therefore decreasing things that bacteria can feed on, therefore again reducing smell. And finally, there are more extreme measures like getting Botox injected into your armpit sweat glands to stop sweating.
It's interesting because there are people that really have what's called hyperhidrosis, and that's what, when he's talking about Botox, you know, everybody thinks that Botox is a wrinkle reducer, but actually it's incredible. You know, Botox is so effective. Just a little bit will last about a year, and it really changes those people's lives. So it's really interesting thing. There's actually some technologies out there too that are around where people treat with radio frequency the sweat glands, and that can reduce hydrosis. But injection with Botox, which actually is it's almost painless, works extremely well.
You might be wondering what I'm wearing, and as am I, because this is a red light mask. It also does blue light. And that is because the claim behind these red light at-home masks is that the red light that you're being exposed to helps decrease wrinkles, and the blue light can help with acne. But I will say, on an evidence scale, 1. We do see some evidence that if you use it consistently, there could be improvements in your skin. It's not enough for me to make this a full go. So for me, it's still a no. I don't want to look like this.
My God, like that it looks ridiculous is an understatement. Yeah, it's totally ridiculous. I think there's so many different versions of this. I would say evidence level 1. I mean, like, there is maybe some evidence, but I would say evidence level like 0.1. Like, it's so minimal. I've actually tried these masks. I tried to have my wife try the mask. I mean, you do it for like 2 days and you're like, this is a complete gong show. I'm not doing it. I'm not going to recommend it to my patients because I like stuff that works.
This is potentially one of the more dangerous products, even though it looks so innocent. It's like, oh, I just put this around my waist and it's going to help me look thinner. It's like, no, this is so incredibly problematic for a human body. This does not permanently change the way you look. When you take it off, your body will return to the way that it looked. Not only does it decrease your ability to breathe properly, it also creates problems in your GI system because it squishes all the organs together.
I have to agree with that. Yeah, these things are problematic. They don't work. I think I saw, wasn't there the person that Shalgunam named wearing that at the MetGaya, you know, that kind of shrunk her waist down? I guess if you've got one event you need to go to and your training and dieting and healthy living's not going so well and you've got to do something, it's maybe a last resort. But there's so many other good options.
Jaw trainers that have gone absolutely viral on TikTok. The claim from these jaw trainer experts, if you will, is that by chewing on these, sticking them in your mouth and repetitively chewing them, you can slim your jaw, give yourself a more contoured appearance, have a stronger jawline. But what they fail to realize is Your jawline isn't really just determined by your masseter muscle. It's mostly determined by your bone structure. Most people who are pushing them are probably modifying their bodies either through surgery, injections, steroids. So don't think that every great jaw that you've seen is because of a jaw trainer like this. It's far from reality.
Spot on, Dr. Mike. Man, that thing is so bogus. If you buy a jaw trainer, seriously, you need to re-examine what's going on. And Dr. Mike said it, if you're working on your masseter muscle, actually people generally want to reduce the visibility of their masseter. That's not a good look. So people actually put Botox sometimes in the masseter, but bone structure, other ligaments that hold the soft tissues, your submandibular gland, all these different things contribute to the contour of your neck. The jaw trainer, I'm sorry, man, out. That's ridiculous.
Next, I don't understand what we have. Reusable facial slimming strap, reducing saggy skin, gorgeous V-up line. It's breathable and comfortable. It's not comfortable. And it's instant face lifting. And apparently it's the new upgrade. I think not only do I look ridiculous, this has no medical research, and it looks like underwear. I don't know, that makes it feel even weirder for some reason. The reusable facial slimming strap is a no.
Yeah, I mean, maybe internists wear underwear like that, but I can tell you no surgeon wears any underwear like that. That's it. But it is completely ridiculous. Zero science to support anything like that. I didn't even know. I mean, it's obviously somebody just trying to make money off gullible people came up with that. We do use some things like that in surgery. It's usually for compression wear. People that we've done something on their neck, other things where you're trying to get some compression along the jawline. Sometimes we'll use a device like that, but it has nothing to do with reshaping or slimming or anything like that. So once again, I support Dr. Mike's opinion. Well, that is some crazy viral beauty trends, and also crazy to see the interpretation of a surgeon versus Dr. Mike, the internist. And there's a lot of similarities, some differences, but it's always full throttle. And if you want more crazy stuff, check out this video on unexplained world records that are truly crazy.